So the idea is that if we can utilize cranial sacral and other manual techniques to help increase the fluid flow in the brain, reduce inflammation, and address the myriad of symptoms that have contributed to the onset of the disease, this could be significant. So again, idea is that if we could, through this cranial sacral still point and other techniques, increase fluid flow, we can reduce this inflammation and create and dampen this formation of amyloid plaque. I have the opportunity right now, and I'm going to do this if you'll indulge me, to talk a little bit about the last 20 years in cranial sacral therapy and its applications to Alzheimer's and dementia in terms of some of this research that we've been building on over this period of time. And Dr. UpLedger, my mentor, wrote a study or a paper in the early 2000s called Cerebral Spinal Fluid, What It Is and Where to Find It. And this is where he started to talk about fluid exchange, what was different in middle-aged adults than older adults. That really triggered me to think about, okay, what research could we do to look even further about where and when cranial sacral therapy might be an intervention. And one of the studies that I helped coordinate with a team of researchers is called the Cranial Sacral Still Point Technique, exploring its effects with individuals with dementia. So this was a paper published in 2008 in the American Journal of Gerontological Nursing. What we did is a still point with people in nursing homes at the same time every day for 6 weeks with people with mid to late stage dementia. And we found out that after about 3 weeks, we started to actually see a change and a shift. We started to see a change in behavior, an improvement in activities of daily living. People began to recognize their caregivers and basically began to show that there was some improvement in memory. That was the starting point for our research that we've actually replicated now many, many times informally over the last 10 to 15 years. But this was the starting point for some of our research. And then again, I just mentioned this as well. We can look at Alzheimer's as not just being a one-pill solution. Somebody asked about atoxic. What atoxic means is that it's not really defined as something that we can see, but in a way that I talk about atoxic, I'm talking about hormonal imbalances. So you can think of atoxic like that. And toxic is in terms of heavy metals. Vascular, again, is vascular supply. And again, trauma. And the reason I bring this slide up again is some of the following research over the last 15 years or so are touching on all these different squares and pieces that seem to be important. One of the things that, one of the studies that was published in 2013, and these are just representative studies, is that interstitial fluid drainage, remember the perivascular space, is an impaired in ischemic stroke and Alzheimer's disease. So a lot of these they did with mouse models. They actually look at mice, look at their physiology, and then see how that might map on to the human genome as well. But the idea there is they're saying that when there's less blood flow, ischemic stroke, that seems to contribute to Alzheimer's. So this is just the ISF or drainage pathway has been hypothesized to underlie the clearance of solutes. So that's one factor. So that's talking about the vascular piece. And then again, here's a study picture of the lymphatic system, just as a refresher. We see here what's called the glial interface at the very bottom layer of this meningeal system around the periphery of the brain is where we find these aquaforins that I showed you, that I spoke about before. And then this shows as a close-up the astrocytes and all of these structures. This is really a close-up of the neurovascular unit, this little square right here. So that's the lymphatic system network. And the reason I mentioned that, published by University of Rochester in 2014, is this is talking about external trauma. And it's saying that blows to head damage brain's garbage truck and accelerate dementia. So this is talking about external influences and how this actually influences in a negative way the clearance of structures in the brain. This is Nekegard, is one of the key researchers And they're oftentimes coordinating with the University of Copenhagen as well as University of Rochester in the research. So this is just reflective of research talking about external trauma. And here's one that's just interesting to talk about because it's long-term aerobic exercise prevents age-related brain changes. So we talk about exercise as being a positive. So this is just one representative study from Science Bailey, which shows that long-term aerobic exercise seems to help in the outcome of not developing Alzheimer's itself. And it says here, if you look, I don't know if you can see the small print over here, it says structural changes that make the blood-brain barrier leaky and result in inflammation of brain tissues, exactly what we were talking about before in old mice, can be mitigated by allowing the animals to run regularly, providing a potential explanation for the effects of exercise on dementia in humans. So the poor mice and rat were sacrificed often, but their turnover in generations is much more quickly, so it's easier as a study model for them to, for researchers to look at that. And then we can't step over, and a lot of people in the summit have talked about this, the gut, right? The missing link between gut and brain discovered with big implications for disease. This is from University of Virginia in 2016. And so a rare and powerful type of immune cell has been discovered in the meninges around the brain, suggesting the cells may play a critical but previously unappreciated role in battling Alzheimer's, multiple sclerosis, meningitis, and other neurological diseases. So it's interesting, people were feeling there was an immune system factor in the brain, and this newest research looking at the SLYM layer by University of Rochester just a few months ago also is built on that. So this is interesting to say that the gut and the brain, by the way, are interrelated because it turns out there's glial cells in the gut as well as the brain. And it's called, sometimes the gut is called the enteric nervous system. And so these lymphatic structures in the brain, in the gut rather, actually talk to the brain. So there's a back and forth. And since a lot of neurotransmitters are actually generated inside the gut, this is an important structure. So gut health and brain, very interactive. So that's another piece. And that can also be reflected in inflammation that gets developed as well over time if the gut is in distress. So here's the neurovascular unit again, just to revisit this slide. And think of gut factors that are impacting inflammation in the brain and see how those are tied together. So again, here's just another study, 2017, the perivascular pathway for brainwaves clearance, current understanding, significance, and controversy. So this is an overview article. The perivascular pathway, also known as the lymphatic pathway, is recently described as waste clearance in the brain. So this is just other research reflecting on this perivascular pathway and why indeed this is so important. Now, as brain ages, glial cell gene expression changes most. So these glial cells that we talk about inside the brain, what they find is that in aging, these glial cells, their genetic expression changes as well. So that can have a negative impact or a positive impact as well. So that's just another factor that researchers are finding that I find fascinating, is that aging can be reflecting in the glial structure of the brain itself. And then here's just another complement to this research. Missing link between gut and brain discovered with big implications for disease. So it's showing this composite image of immune cells and being important defenders of the brain. By the way, I'm going to share all these slides with you at the end and give you a way to access these in case you're interested. So it's very interesting that, and this is Virginia School of Medicine, saying that indeed there is a connection, again, just a little bit more of a backup scientifically, to talk about what's called the microbiome of the gut. Notice this word because this is a hot new area of research where people are talking about gut microbiome and how important this is in all of our health and what happens if the microbiome is out of balance. I'm just mentioning this because in terms of some of our ongoing research, at the UpLedger Institute, and I teach for UpLedger for many years. We actually were at their headquarters in 2018, 2019, and we did a 1-week intensive therapy session with about 8 people from around the country, and we had therapists, 24 therapists from 5 different countries around the world, and we did intensive work with them. And then we repeated this same study again the year later in 2019. And what we found is that clinically, by applying this, that if people had more intensive work, that seemed to roll back or at least stop areas where there were problems with memory. And we found that almost everyone found some improvement. And what's interesting is that when you roll back and start to get deeper into the body, people almost go back step by step and start to remember, oh yeah, this happened to me at 50, this happened to me at 40. So in other words, the body has a memory and there's accumulated traumas. And if there's some way to help dissolve them so they don't keep having the deleterious impact, this could be important. So I'm just mentioning that as well. And this is interesting in terms of Boston University. What they found is that waves of CSF, cerebral spinal fluid, flow into the brain during sleep, because we all know how important sleep is in terms of Alzheimer's as well. So this is just another factor I wanted to mention. And what they found, I don't think I have the slide for this. Yeah, well, it shows another slide. And then does it? Yeah, it shows this, is that if you see this in real-time imaging, is that during sleep, here's that little blue down there, that's around the choroid plexus where CSF is manufactured largely. And then here's the periphery of the brain. What it shows in the real-time imaging is that these red spots which grow is that there's vascular flow, but if someone falls asleep, then it's as if the CSF, like a wave, is invited to flow right behind the vascular structure. So waves of CSF flow into the brain during sleep. And this lymphatic system does about 60% of its work during sleep. So it's as if during sleep, if sleep is more effective, the more clearing there is of toxins from the brain. And how we feel cranial sacral therapy is complementary to this, is that it helps relax and get more fluid flow in the brain structure, also relaxes the body and lowers sympathetic tone so people get a better sleep. So it's complementary to sleep, which is very key as well. And this is an interesting one. It's called The Effect of Osteopathic Cranial Manipulative Medicine on the Age Rat Model of Alzheimer's Disease. And quite independently of our look at what's called the cranial sacral still point, what these researchers did, this was published in 2019, is that they actually, let's see, yeah, I'll show you this first. This is a compilation and measure of some of the equivalent, some of the factors of the study. But what they did was a still point, which is done at the head. It can be done anywhere in the body, but they did a still point on a rat, and they did it with their little fingers. And how do you do the still point in a rat? Very carefully, you have gloves. And they actually did the still point on a rat. And what they did, they have a model where the rats can run into a maze, and they can tell by the way they navigate the maze how well their memory's doing. And what they found, a significant increase in the rats when they had been treated by the still point. And then they were able to image by imaging, MRI and other imaging, live imaging of a change in brain structure. And then when they sacrificed the rats and did an anatomical dissection, they actually found there were more aquaphorins. Remember those little tiles that I showed you about that conduct cerebral spinal fluid in the brain? They actually showed that there was an increase in some of these immune systems, or rather glial structures in the body. So that was interesting, quite independently, that another way to apply the still point was shown in this rat model. And here again, there was more increase of these structures, these aquaphorins of the brain. I would have been happy with just knowing that they had research which showed that there was a maintenance, but actually it showed that there was more of a proliferation as well. So I wrote this article in, I think, Massage Therapy Magazine in 2020, the current state of affairs, Alzheimer's research. And then, again, as I referred to this before, newly discovered anatomy shields and monitors brain from just this last January from University of Rochester. And they're looking at this structure in the center of the subarachnoid space, which seems to do something which actually helps to monitor the immune system and keep the immune system defended. And of course, I think this is key, because if the integrity of this structure is maintained, it means the brain has a structure to protect itself from invasion. But if it doesn't, then things start to, as if, have a little bit of a meltdown, and there's more of a problem. So that's important, I think, in terms of that discovery of this particular anatomical structure. And just a little nod to COVID, not surprisingly, association of COVID-19 with new onset Alzheimer's disease. It was found very recently that people 85 years or older, which is obviously a little bit more of an advanced age, but they were at significantly more risk if they had contracted COVID to contract Alzheimer's and develop memory problems. So just a nod to that, to mention that. And then finally, Boston University found CT, or chronic traumatic encephaly, in nearly 92% of ex-NFL player studies. So what they found is that not only, which is part of an ongoing study that many people have looked at in terms of brain injury and inflammation in the brain, but a lot of these people are much more prone to developing Alzheimer's type symptoms as well. And this is just another study, association of APOE, which is one of the genotypes more commonly associated with Alzheimer's, and chronic traumatic encephaly. It was found that in these players in the study, that if there were more of the genotypes of the APO genes, and they also had CTE, that the risk of Alzheimer's was significantly greater. So that was just an interesting survey. So all these are pieces of the puzzle. And before I end, I just wanted to share a little 5-minute video. You know, when we talk about the still point, when we talk about treating with cranial sacral, even 5 to 10 minutes a day, I just wanted to share with you a little bit of an overview in this video. So hopefully you can see this, of some of the therapists over the years around the corner and some of the results that they've seen.
Remarkably different.
Can you hear that okay?
Seems happier. And
Yes.
All right, good.
easier to have a conversation, like when she can follow the conversation.
Instead of being called Roxanne or daughter, I was you.
Okay,
And my brother was that man or him.
okay.
The third day, partway through church, she said Roxanne.
Mhm.
And it took me a minute to figure out that it was her saying Roxanne and not someone else. And then
Right.
to adjust from the shock of that. And then while I was adjusting from the shock, she said, "You know I'm talking to you. I just said the name I gave you. You're my daughter, Roxanne."
He does feel, and he voices that he feels the cranial has helped him in his day-to-day living. He now bathes almost daily, which he didn't do before. He now does his own laundry, which he didn't do before. On a week-to-week basis, he recalls more now than he did when we first started.
Actually, I have noticed during this trip, during these 4 days of him getting worked on, he has been extremely easy to get along with, and I haven't noticed any kind of agitation or difficulty getting along with him during the trip while he's been worked on.
Great.
That he is much more manageable, much more easy to get along with, less forgetful, and more in the current and present moment.
Okay, great.
He's actually been quite enjoyable to deal with the past few days. I have had no difficulties at all with him.
And feeling her anxiety level decrease.
Oh, okay.
That came from her caregiver was that she repeated herself. She repeated herself less often
Mhm.
as far as asking the same questions.
Yeah.
And she even noted that she could catch herself quicker,
Right.
recognize that she was
Mhm.
about to repeat herself and not do that.
There was times that I would show up at the nursing home and she would be sitting in the dark and not really even notice that she was sitting in the dark. It actually got to the point where I'd go to show up to see mom at the nursing home. And, I was used to finding her in her room. And all of a sudden I had to go looking for my mom in order to find her. And she'd be out, sitting at a table with one of her friends, and they were having a bit of a conversation, or she would be doing something with one of the volunteers. And that was very unusual for mom at that point.
Her sleep cycle reversed, which was a good thing because she was staying up all night and sleeping all day. And this completely changed. The caregiver was telling me that she was now sleeping normally all through the night, and not just like sleeping through the night, but really sleeping deeply, sleeping well, full 8 hours.
What's interesting is it's been 2 weeks since I stopped the treatment, and I actually saw her just recently. I went to her room to meet with her and her daughter, and immediately she was so happy to see me, and she did the same thing. She got out her chair and was ready to sit down for her treatment. So, I think that's pretty significant for someone who has no short-term memory. Remember, I told you, she was starting to be very withdrawn, just sleeping most of the time. And the staff are telling me, wow, it's a lot more alert. She's making conversations with us. And that's what was so rewarding for me. It was just like I was seeing her wake up and come back to life.
She also said that he was not as agitated. He was much calmer, and he was willing to do things. So they joined the YMCA. He went for swimming. They start walking every day from half an hour to an hour. He wanted to do things, and he likes to bike. So he was able to bike, and even like quite far, and he never had any issues finding his way back home, where initially sometimes he will. From being kind of a grouchy man going to a happy, nice person looking toward things and trying to have so more life inside of him. It was like desire to live and to do things. There was that peace inside of him that I didn't see at the beginning of the treatment.
It's been a wonderful experience for me as the daughter to be able to have that time with my mom, and to be able, to be able to, she's taking care of me my whole life, and to be able to give her something back for her quality of life. It's been really big.
All right, and now we will go back to our presentation. Let me see if I can find it here. Okay, good.
Okay, Mugly, you may need to unshare and share your screen one more time so we can get onto.
Okay, get back again. Thank you so much. We kind of jumped onto the another structure there. Okay, how's that? You see that? Thank you. So what's interesting is that when we did our initial study, one of the things that we found is that we lowered stress in people fairly quickly. And one of the things we found is that we lowered agitation. So that's like a commonality. These are people with mid to later stage. But also one of the interesting things that one of the therapists mentioned is that as people got more and more treatment, they would catch themselves when they were repeating. And if you've been around with people that have memory problems, often they'll repeat. And they would actually catch themselves and break that cycle. So that's something we've tracked that's fairly consistently as well, whether we're doing this anecdotally or in this official study. And here are some of the 5 A's of Alzheimer's. I'll just mention a couple. Agnosia, information from the senses, hearing, touch, taste, and vision, that can degrade. Anomia, which is a common one. Problem was with word finding, people being able to locate that a little more easily. And aphasia, loss of spoken language or speech comprehension. So those are some of the factors that we're looking at to see as we can get an impact as we treat. So, and, oh yeah, and apraxia, loss in voluntary motor skills, which is more advanced. In amnesia or memory loss, there are many causes of amnesia besides dementia. And sorry there, I didn't put an A on a little typo there on the end. But basically, we're looking at all those factors when we're looking at how we can have a positive impact. So results that we've seen, decreased agitation and accurately perceiving the environment and the ability to know one's position in time, space, and location, and having a sense of self, which is tied to memory. And of course, one of the tragedies of Alzheimer's is that people lose their sense of self. We don't have a person to communicate. So what value would that be to be able to preserve that, even maintain whatever current level of dysfunction there might be, let alone being able to stop or reverse that? And language skills improvement, words that make sense from one word or phrases to another, and decrease of aphasia, and thinking and reasoning. So these are things that we've seen as far as improvements. And with one test, as I mentioned, there's something called the Cohen-Mansfield agitation study, which shows that we saw a significant change in reduction of agitation. And this also, in terms of what we've done anecdotally, tracks with changes observed in our original study over 10 years ago. Now, all of this leads to something, and this is kind of a model that we've developed from autism called functioning recovery, that to whatever degree that we can get improvement, then the quality of life can improve, and we could design a program and have a team of people to determine at what frequency and what needs they have to maintain the gains they already have. Because what we found is if they have consistency in treatment, they seem to maintain. What happens when they don't is that people tend to slide back a little bit. So functioning recovery means that people could have a more functional and viable life, even if they have, started down the road of having this diagnosis. And so we're proposing a manual therapy approach that can reduce neuroinflammation in the brain, slow the progression of the disease, remove toxins from the brain, and again, stabilize these gains. And so our implementation approach would target those who are interested in prevention and those who are also at the early to mid stage of the disease process. And we have a 2-day training that we have even for lay people. I just did one this last weekend. So people can learn how to apply this for their friends and loved ones. And then also a program for therapists that are more certified in the UpLedger Cranial Sacral that can be applied for at-home and private practice or senior care facilities where we started to train people. And also we're starting to certify longevity therapists so we can refer people all over the country. And then create customized programs for in-house staffing at senior care facilities. And offer advanced treatment programs. These are called mini intensive programs for people that already have symptoms or just want to buttress their nervous system so they don't develop these problems. So I'll skip this right now. I want to mention really quickly, because this was part of, and this is just the last little piece. We did a summit last year and we talked about the hallmarks of aging. This is something, this research will change the nature of how we talk about aging longevity in the next 20 years. And again, as I mentioned, there's natural and pharmaceutical companies, approaches rather. We've looked at the ways to prevent and treat memory challenges, and we talk about treating the specific disease. That's one approach pharmaceutically. But another is expanding our horizons. And what the diseases of aging is saying, what these hallmarks of aging is saying is that we can look at the entirety of the disease process and look at how we might not only approach Alzheimer's, cancer, but all metabolic diseases, including arthritis, inflammatory diseases, and diabetes. And a lot of people at Institute of Functional Medicine are kind of looking at things in this way. And what if we could intervene earlier and identify at a cellular and genetic level the conditions that are common to all these diseases of aging? And what would be the result if disease could be prevented altogether and aging would not be progressive? And in something called the Hallmarks of Aging, a paper that was published by Cell magazine in 2013, this is the way they describe aging. Aging is characterized by a progressive loss of physiological integrity, leading to impaired function and increased vulnerability to death. This deterioration is the primary risk factor for major human pathologies, including cancer, diabetes, cardiovascular disorders, and neurodegenerative diseases. So that's a way of saying that the old model was that as you get older, things go downhill, in a sense. What if something could be different? What if we could identify treatments where the quality of life could be improved for whatever lifespan could be enjoyed, kind of wanting to end on a positive note, and life expansion could be possible. And, you know, a lot of people say, I don't mind getting older if I'm not sick or in ill health. So that's kind of our approach, is to say that if we can maintain health and help support people who do have issues and help slow the progression, maybe stop it altogether, and work with other modalities and work with more intensive work, we can have a more of a positive impact. So what I want to share with you, if you take a picture of this is a QR code. If you want to scan this from your phone, this will take you to where you can sign up and get a copy of the PDF for this whole presentation. So I'm going to leave that up for a minute, just so you can start to have a moment here to scan and look at that. Thank you for letting me go a little bit over on this. I know we have some questions, so I'm going to leave this up for just a minute before I stop sharing the screen. All right. All right. Good.
All right, Michael, thank you so much for that very informative presentation. I already downloaded my copy of your presentation. Okay,
great.
Appreciate you making it available to everybody, as I'm sure they do as well. So we're going to begin our live Q&A session. It'll be a brief one. So I guess if you can keep your answers brief, so maybe we can get a few more questions there.
All right.
And just real quickly for everybody, just so everybody knows, we're not taking questions from chat. You have to raise your hand, go to the reactions button, second from the right at the bottom of the Zoom, and then you'll click on raise hand from that button. And when I call on you, I'll ask you to state where you're from and to ask your question. We just ask that your question is brief and on topic. I want to ask you a couple of quick questions though before we take some audience questions, which is, what is the, I know you have a 2-day training, so I don't expect, for you to be able to cram all the 2-day training, in right here. But what is the basis? Is there, first of all, is there more than one thing? I've seen things on like cranial pumping, I think, or
right.
So what, like, is that part of the therapy? And if so, like, what is the basic treatment that's done? And then also the still point technique that you referred to in your presentation?
Right. And just kind of explaining what this is to keep it simple is it's a manual therapy technique. So it's hands-on. And the idea is that without getting too much in the weeds, there's a flow of cerebral spinal fluid from the head down the spine and the sacrum and back up again. And what Dr. UpLedger found is, even with people without extensive medical training, is that you can put your hands on the head and you can feel this cranial rhythm, which allows the head to widen and narrow. And with memory problems, yeah, I know, it's just like, it just takes a little training, but just like you train a doctor how to listen to the respiratory system or the cardiac rhythm, there's a more fundamental system called the cranial sacral rhythm and cranial sacral system underlying that. It underlies the whole skeletal muscular system. And when you start to listen to that, these deeper structures of the bodies just start to come into your hands and your awareness. And it's the idea that if you have a normal flow, then things are great. Remember in the slides how I said that there can be a decrease of cerebral spinal fluid over time? Mm-hmm. Well, what you can do with the still point and also the cranial pumping, these are two allied techniques, this can help kind of pump up the volume, so to speak, of cerebral spinal fluid in the head. And as you listen and do this thing called the cranial sacral still point, it's like hitting the the reset button on your computer. It's like rebooting your computer, or if you have a old thermos, and you hit the red reset button, it like resets the system. When it does that, the whole system gets more fluid flow in the body and in the brain. And by doing that, and this is where we found anecdotally over 30 years that can help with headaches and migraines. It can help lower the stress level in the body. And it seems to have the benefit of, and we want to do even more research on this, but it seems to have the benefit of increasing flow inside the brain. Just by listening to the cranial rhythm, like who knew that was possible? And it's very subtle. It's like a baby touch. And it seems kind of crazy, but just by putting your hands on the head and listening and tuning in, you can start to improve that flow.
I don't think it sounds crazy. I'm actually trying to feel it.
Yeah. Well, it takes a little time just to be quiet and to listen and see what happens with people with memory problems is typically their rhythm is slower and their body feels stiffer, not surprisingly, right? And because of that, there's less fluid flow also in the brain. And things get clogged up like that river that gets clogged up. So the idea is by simply doing this 5 to 10 minutes a day, you can at least help maintain and prevent. And if somebody has more aggravated symptoms, you could do more intensive work getting together with a number of therapists to help clear out the system. And it's so simple. That's why we feel we can reach a lot of people worldwide, because in a couple of days, people can get the fundamental and train and then get backup support as they continue with the work.
Where would we physically touch ourselves to find that rhythm? And is it similar to a pulse where it's sort of just like ooh kind of a thing?
Yeah.
That we feel? So where would
there are any number of oscillations in the body. There's a heartbeat,
Mhm.
there's even a circadian rhythm. It's the way we respond to the environment. And so it's body wide, it's anywhere in the body. So when we do what's called a cranial sacral still point on the head, it's called the UpLedger handshake. We actually have someone lie down on the table and we're right in the back of the head, very opposite to where the cerebral spinal fluid is manufactured in the back of the head. And we just do this simple technique called a cranial sacral still point at the head. Now, because not everyone has a table or maybe a way that they can get to a partner and work with them lying down, we also teach people how to do it just sitting. So you can be at the shoulders and listen to the cranial rhythm. It's called external and internal rotation at the shoulders, and do it that way as well. So we've been in nursing homes where people are sitting around watching the TV, watching Lawrence Welk or I Love Lucy or what have you. And we'll just go from person to person and do a still point right there on their shoulders and do that. And that seems to be just as effective. So we train people to be flexible. But in answer to your question, yeah, it's ubiquitous. Like the cranial rhythm is found throughout the body. And the more we can intervene, the easier it can be to get the results.
Okay. And first of all, is that in your book? The 10-minute to discuss
It's in the book, but you need to get some instruction to learn how to do it. Just because you're saying, hey, can I feel it or not? We basically lead you through feeling the rhythm so you can start to tune in and feel it, and then have you practice on other people so you get the validation and the confidence that you can feel it. It's not hard because it's been there our whole life. The cranial rhythm's there from about 2 months in utero, and it's even there for about 20 minutes after someone passes away. It's like such a fundamental rhythm in the body that it's just there as a vibration, and we're tuning into it. And why we think cranial sacral is so effective with so many things is that we're getting into that fundamental core value of the nervous system and allowing the body to talk to us. In a way, what we're doing is listening to someone at the deepest possible level. And if we listen to them at the deepest possible level, the body will go, oh, yeah, I'll start to give things up. I'll start to cooperate and listen to you. So we're listening in a very profound and respectful way to the body, which is why I think this is so effective. It's just wonderful to feel that in someone's body and to be of service to them in that way.
So our audience has a lot of people who have recovered from stuff, but also who are proactive in their health, right?
Yes.
Is this something that can be done proactively? Is this something that an individual can do to themselves?
Yeah. And that's part of what I teach in the 2-day class. And other, UpLedger has instruction for even 4 days for therapists. So yeah, You can learn to do it on yourself. There's something called a still point inducer. You can go to my website, preventingalzheimers.com, and find out where to order one, or go to UpLedger Institute and find them. And you just put this little device on the back of your head and rest on it. So even without somebody there, you can treat yourself, and it's great for prevention. And a lot of therapists will hand those out or have somebody buy them. They're about $25 to buy a still point inducer, so they can do self-treatment between treatments, or, you know, to work on themselves in that way.
And what would a healthy person notice if they started adding that into their either daily or however often they should do this kind of thing, whatever the routine is? Listen, there's a lot of people, including me.
Yeah.
Well, I was out on the beach this morning at 5 something in the morning, so I will do this kind of stuff. It sounds very
Right.
good. What kind of benefits would we see if we start adding that into our lives?
Probably the most immediate thing is you'll feel more relaxation and less stressed. So one of the great things is, you can tell, as people have talked about, in this seminar, stress leads to so many disease processes, right? Anything we can do to lower stress can be a benefit. So that's probably the most immediate. Like when I get cranial sacral, I go like, I don't know where I've been for 10 minutes or 20 minutes or half an hour, but I know it's better because my body feels like it's more in harmony with itself. So that's one thing. And then they'll probably realize that because there's more presence of mind, they may start making better choices in terms of diet, in terms of, just because we're less stressed. We had a speaker at our Beyond the Neuro conference, Stephen Porges, who developed polyvagal theory, talking about how stress in an autonomic response will just keep our body on edge the whole time. So the more we can lower that, the better our thinking would be. So we'll probably feel less stressed and more relaxed, and as a basis of that, make better decisions. The reason why I want to teach people, if someone's developed memory problems, they can't remember to put that device behind their head or do it, so we want to have somebody do it for them. And wouldn't it be great if even the grandkids could work on grandma or grandpa or mom and dad, and the kids could help? And it's very, even a young kid can learn how to do this, basically, and they're pretty innocent. They'll tune in to feel the rhythm. So that can be very powerful as well, very positive.
So you mentioned during your presentation that I believe you called it cerebral inflammation. It's a major part of the pathway toward Alzheimer's.
Yeah.
And that's part of why the fluid is unable to, go through the brain properly and
Yes.
detox the brain. We've, at this conference, we have a lot of speakers who are world-renowned plant-based doctors. Inflammation is a huge thing with the whole food plant-based diet.
Yeah.
Do you see the role of diet in preventing or mitigating Alzheimer's and other neuro issues, and specifically a plant-based diet?
Yeah, it's an important piece of the puzzle. And in my book, there's all sorts of theories about diet. I'm kind of a paleo guy. That's just me. It's kind of protein and vegetables. But some people, there's more keto. There's a whole range of the approach. But nevertheless, whatever approach in diet, and that's going to be different for each body. Each person is going to be maybe different in what they need. So the more we can tune into that, and this is why I call cranial sacral like the missing piece. Because metabolically, if you're doing something, you're taking vitamins and minerals and supplement, if you're actually doing anything that might even be plant-based, which is all good, is that metabolically, you need to be able to absorb those nutrients. Remember the microglia I talked about in one of those studies? How you can affect the microglia and the absorption and remove any structural stresses and strain is important to make whatever you're doing more effective. So that includes whatever you're doing in terms of diet. It's just making the gut happier, which is a big thing as we age, gut issues. And, that's important to be able to absorb the nutrients. So it complements any approach that we have to diet, whatever that approach might be.
So your research doesn't show one diet being better than any other diet?
Not particularly. That could be a whole nother study to say. And, Dale Bredesen's done a lot in terms of, he will actually do specific tests and blood tests to say, what are the different factors? What can be mediated? Cranial sacral therapy can help complement any of those approaches because it's going to maximize whatever the imbalance is in the physiology, if you will.
Great, thank you. So we're going to go to the audience. I'm going to ask Lisa, where are you from and what is your question?
Hi, I'm from Jackson, Tennessee. My question is this a technique someone like myself could learn? And is there some type of video training, or do you have to travel somewhere to get the training? Just, interested in learning the technique myself.
Yeah, hi, Lisa. Yeah, you can
Uh-huh.
learn it. I developed a video program, so I just did one this last weekend. So it's a 2-day training. You can learn, you can work on yourself at home or have someone there with you to practice on, and then we'll support you in the follow-up. So you can learn how to do it as well virtually. If you go to my website, preventingalzheimers.com, or if you take a look at that QR code and sign up for my newsletter, we'll tell you when we're doing our next training.
Thank you.
Yeah, you're welcome.
All right. Next question is coming from Steve. Steve, where are you from? And what's your question?
Hi, Steve from Rockaway, New York. Like Michael, I just went and took a look at the still inducers, and there are a bunch of them out there. There's a CD that gives you music and stuff. They call that a still form inducer. Aside from saying, go to my website and buy mine, how do we know which ones are good?
I would go to the UpLedger Institute, the UpLedger website, UpLedger, UpLedger.com, and look at those, because those are the official, if you will, quote unquote, still point inducers. Or here's a cheap and down and dirty way to do it at home. Okay. And they even mention that, even UpLedger mentions that as well. You can get a couple of tennis balls and an old sock. It doesn't have to be an old sock, but a sock. Or if you want it softer on the back of your head, get a couple of at Walmart, a couple of those blue racket balls.
Silicone balls.
Yeah. And put that there and then tie a knot, and then you'll have 2 bumps. And you put those 2 bumps on the back of your head. It's good to have a little instruction of where to place it, but that's basically what you do. You just lie and nuzzle in on those. So if you don't want to get the still point inducer, you can make your own as well. So that's a good self-help to do at home.
So,
and you line up for
Thank
about 5 or 10. Yeah. Thanks for asking.
So real quickly with that, because that's actually, I think what I was trying to get to is, how do you do this at home?
Yeah.
So we take the a sock, we put the 2 balls in there, tie a knot at the end of it just to hold the balls in place, put it in the back of our head. Where ideally should it go in the back of our head?
What we want to do is push it above the ears and come back to what's called the bump in the back of the head. It's called the external occipital protuberance. And I'm going to swivel around, so I don't know if you can see me by doing this, but it's kind of like right about here. And the bumps are on either side. So the bumps are on either side, right behind, right here. And you just nuzzle on that for about 5 minutes. It's not maybe as effective as someone doing it manually for you and listening, but it'll still get the result. Just lie on it for 5 to 10 minutes.
All right.
So that's a good point. So thanks for asking about that.
Great. Well, you know what I'm going to be doing later. So our next question, I'm going to ask you another question because I had another thing. You mentioned that Alzheimer, people are getting it at a younger age. Oh, actually, you know what? I'm so sorry. We're actually out of time. This was so engaging that I lost track of time. So we want to thank you, Michael, for such an informative presentation. I wish we had more time for questions. If we can unmute the audience, please.
Thank you so much.